3.3 FM, the Ray Gibson show a couple of mornings ago, and we want to bring you what he said because he minces no words about his support for Bill 112 and why he believes doctors on Guam are opposed to it.
You had a healthcare issue you wanted to discuss.
Well, I've been following closely the bill that is going to allow patients to sue doctors on Guam, and I think there's a hearing which is set for July 7th and July 12th. It's pushed by Dave Lebowski, whose son unfortunately died because of where physicians just didn't. It was because of poor care, and I think the population should follow it. This is the time of year, I call it long day dementia. In June and July, I don't know because if it's a hot, long days, people don't remember. And when there's hearings in June or July, this is when things are forgotten or things, are not even addressed. But Guam has such a broken peer review system. It has failed so terribly that I think people supporting the ability to appropriately sue physicians may be a way to have the medical industry correct itself, because lawyers step in when an industry or a profession fails to self-discipline and correct itself, when there's engineering problems because people cut corners and people die.
Yeah.
And regulators won't do anything, lawyers step in. In this case, as much as I tend to dislike litigation, I think people should follow it very closely. I think it might be Bill 112. I'm not sure.
I forget the number. I know Tom Shea has a very, very interesting position on it. Says he's not going to do gynecological cancer treatments anymore because the people over at the legislature.
Doubtful.
Yeah.
Don't believe it. These doctors on Guam get paid very well. At the hospital, they're way over what the national average are. And it would require, I carried malpractice even when it was available on Guam. I have been in high-risk positions. I carried it even when I was in CNMI when I was going to go into private practice, and everywhere since then. I have a requirement in the U.S. hospitals. Number one is malpractice. Number two, to be board certified. But I can tell you I have never been mentioned. I haven't had a malpractice lawsuit because I try to practice within the standards. Guam, because they have a peer review, which is actually, and that was a bill that Lou Leon Guerrero introduced years ago, meant to help physicians. It actually hurt Guam, and you began to see problems you begin to see problems with physicians when their review of other physicians became cloaked in a star chamber. Because what it really became is anybody who says anything violates omerta, goes into the star chamber and is canceled. I mean, I'm an example of one of them. They're canceled, or they lose their license, or they lose their privileges. So it protects bad doctors and can often impact good doctors. So if this bill is passed, what you're going to see is life-saving on Guam. You're going to see physicians beginning to say, if I don't report this other doctor and he gets sued for $300,000 or whatever it is, my rates are going to increase. My premiums are going to increase. And that doctor, for example, if it was dealing with a case like Dave Lebowski's son, who was basically drowning in his own secretions and nobody wanted to get out of bed to transfer him to the ICU, he would say, oh my God, I'm going to have to pay a $30,000 or $50,000 co-payment, deductible on the settlement, and my premiums are going to go up. And all the doctors will begin policing themselves because they don't want to pay higher premium. I hate to take that position because I no longer have a skin in the game, but this is the way it's got to be.
Well,
there's no choice.
Important for doctors to hear because there seems to be a wide variety of opinions on this from all sides. 9:36 in the morning. Dr. Macris, always a pleasure talking with you. I appreciate the extra time today. You have a fantastic rest of your Tuesday evening, and we'll get caught up.
So Dr. George Macris reviewed the nurse notes in the Asher Dean Lebowski case and said the boy was drowning in his own secretions while the doctors were in bed. It just doesn't get more clear than that. And his the history he gives out about the peer review process and this mandatory arbitration law, and then what he believes would happen if this law is repealed. And it's not that the Speaker's bill gets rid of a process; it actually just makes the process accessible to poor people, so that poor people can have the ability to hold bad doctors and bad nurses accountable. What is so wrong with that?
You know, I've worked in the medical field since I was around medical people, around nurses, around doctors, and I've watched them. The nurses that are very headstrong and